Hi, everybody, and welcome to episode 51 of the Pet Behavior Chat. And this episode is going to be a little bit of a follow on from last week's episode. So, last week we kind of introduced the notion of psychopharmaceutical medication, also known as psychotropic or psychoactive medication, also known as behavior medication or behavior meds. And last week I kind of introduced you a little bit to, who is a candidate, which patients are candidates for medication. And we kind of went through that, all the things to kind of look out for. And today I want to talk about long-acting versus short-acting medication, because in my experience, there is a lot of confusion around this topic, especially amongst the veterinary community. So sometimes, vets will contact me not sure what medication to use. And there is definitely, I think, a little bit of a lack of education around, the idea of baseline medication or long-term medications or short-acting medications and when either of these are used. So I'm going to talk a little bit about that today. I don't think it's going to be a massively long episode, but I just want to kind of make really clear the difference between those two categories of medications and when we might reach for the one and when we might reach for the other. So before we kind of dive into the medications themselves, we need to understand a little bit how they work. And with medication, always, it comes down to neurotransmission and neurotransmitters. And the different sort of actions of long-acting versus short-acting medications is often to do with their neurotransmitter profile and which neurotransmitters, and more importantly, which neurotransmitter receptors they act upon, because that's going to inform us a little bit about how quickly they start to take effect and, how long they last for. And it's really quite different between the long-acting versus the short-acting medications. So if I talk about the long-acting medications first, and I'm not going to go into too much detail, but I think it's important for the vets and the veterinary nurses and anybody else who has an interest in how the medications work in the brain and their mode of action and mechanism of action. It's really important that we just kind of have a bit of an understanding of this. And the long-acting medications usually act on what we call metabotropic or G-protein coupled receptors. They're a special type of receptor that usually have kind of slower, more long-acting effects and modes of action. So I'm thinking about medications such as the SSRIs, the selective serotonin reuptake inhibitors, or the TCAs, the tricyclic antidepressants, maybe even the SNRIs, the serotonin and noradrenaline reuptake inhibitors. So all of those medications that we want to be thinking about as a baseline, or it's kind of our foundational medication, the medication that we think is going to do the heavy lifting of either anxiety relief or controlling impulsivity or reactivity, maybe aggressive behaviors, that sort of presentation. They're the medications that we give every day. They're the medications that are given over a long period of time. And by long period of time, I'm talking at least 12 months, maybe longer, maybe even lifelong. And the reason that these medications take a little bit of time to work is because of this metabotropic receptor profile that they have. So metabotropic receptors work via a number of what we call messengers. So you've got a first messenger, a second messenger, third messenger, fourth, and so on and so forth. So it's kind of this cascade that they release, or this cascade that they kind of activate when we use these medications. So our first messenger is usually the medication binding to the receptor, right? So that would be our first messenger. And that then releases the second, third, fourth, fifth, however, many more messengers there are in the cascade. And eventually what happens with these medications is that they actually affect gene expression. So, in the final steps of that cascade system, they affect gene expression, and they actually cause the building of new proteins, new receptors, so that we start to get a re-regulation or a rebalancing of the neurotransmitter system. And that obviously takes time. So that's why these medications are called long-acting. And they also take time to take effect. So most of these medications take at least 4 to 6 weeks before they become effective. You have the initial couple of weeks where you might see side effects. Then you have a couple of weeks where you don't really see any huge effect. And then it's usually by weeks 4 to 6 that we start to see the positive behavioral effects of these medications. And that's because of the activation of this messenger system and this cascade that essentially causes new proteins and new receptors to be built through the change of gene expression. So it's really important that we know that, because I think sometimes these medications are used incorrectly. And I've seen this done when I've had referrals, perhaps from colleagues who aren't maybe as familiar with the medications. They'll give the medication to the patient for a couple of weeks, 2, 3, 4 weeks. And when they don't see any change in that short period of time, they stop the medication because they don't think it's working. And that's the mistake, right? Because we know that it takes about 4 to 6 weeks to start working. So if we stop them after 4 weeks, we haven't given the medication a true chance or opportunity to show us what it can do. And so that it's a massively important piece to me, because it sometimes frustrates me a little bit, because then the medications start to get a kind of a bad rep, a bad name. Oh, the medications don't work. And that's because they haven't been given the opportunity to work, because they haven't been given long enough time to take effect. So it's really critical that we think about that. And, we always have to educate clients and caregivers and say, look, it's going to take 4 to 6 weeks until you see anything. Yes, you might see side effects in the first couple of weeks, and those side effects sometimes are nice side effects. If we have a very kind of overactive animal, that sort of reduced activity side effect can be quite a welcome side effect, and they think, woohoo, great, the medication's working, it's amazing. And then in weeks 3 and 4, as the side effects go away, all of a sudden, then we think, oh my God, behavior is getting worse again. But that's when it's really important to educate. No, you have to hang in there. You have to stick with it. We have to wait for at least 4 to 6 weeks. And I've also seen instances where it takes even longer to see positive effects from the medication. Sometimes it's kind of at the 3-month mark where all of a sudden, like, wow, okay, we're seeing big changes in the behavioral presentation of the patient. Sometimes I've seen it take, 6 months, sometimes even longer. And the other sort of really interesting thing about these medications is, because they continue to build new receptors, because they continue to have this effect, behavior can actually improve, or you can see behavior changes over time. So things get better and better and better, probably in the first 12 months, and then they may reach a plateau effect. But we may want to still continue medication after that, which is why I always educate my clients that I'm looking at probably, a minimum of 12 months for these long-acting medications initially, because of how they work in the brain and the added benefits and advantages over time. So it's really important that we know that. It's really important that as veterinarians we know that, because we want to make sure we're giving good advice, we're giving informed education, we're giving informed, advice to our clients, and that we don't just then stop them after 4 weeks because we think that they're not working. What we absolutely might need, and this depends on, the patient and the presentation, and this follows on from last week's episode a little bit, is we may need a short-acting bridging medication to help us through those first 4 to 6 weeks until the long-acting medications start to become effective. And so that then takes us into the realm of short-acting medications. So short-acting medications, exactly as the name suggests, is they start working very quickly, usually within, maybe minutes to hours. So somewhere between 30 minutes, probably to 2 hours, they start working, but they also wear off quite quickly then. They have, their effect might be for 4, 6, 8, 10, 12 hours, depending on the medication that we choose. And again, that comes back to how they work on the receptors and which kind of neurotransmitters they affect. So oftentimes these short-acting medications will work on GABA and glutamate. So they're the two big the two big neurotransmitters in the brain. GABA is our big inhibitory neurotransmitter. Glutamate is our big excitatory neurotransmitter. And, so the medications that affect these usually work quite quickly because the receptors that these neurotransmitters bind to, and the medications also bind to, are many of them, and there are a few exceptions, what we call ionotropic receptors. So they're also called ligand-gated ion channels or voltage-gated ion channels, but they're receptors that, when either the neurotransmitter or the medication bind to these receptors, it opens up a pore, almost like a channel, and allows ions to pass through it. And this can cause an effect really, really quickly, like I say, within minutes to hours. So the way that these medications work are quite different. They're fast onset, and then they're also quick to stop their effects. They only last for a few hours. So when might we use these medications? Well, these medications are also what we sometimes call event medications. So we might use them before a particularly stressful event. The classic example here is going to the veterinary clinic, or you might use them before visitors come to the home, or you might use them before a noise event such as, fireworks, thunderstorms. You might use them before you take your dog out on a walk if there's very fearful or reactive on walks, for example. So those are some of the events that you might consider using these short-acting medications for. Where things get a little bit complicated is that we can also use these short-acting medications on top of our long-acting or baseline medications on an everyday basis. So I think that sometimes is where the waters get a little bit muddied, right? That's where it's like, well, hang on, are these everyday medications, or do we use them just for specific events? So we have to have an understanding that these medications can be used completely on their own, before a vet visit. So classic example here is maybe the cat that goes to the veterinary clinic and is given gabapentin beforehand, or maybe the dog that it has separation anxiety and is given a medication before departures to help them through that time of departure, or the dog that is noise phobic, that might be fearful of fireworks or storms, that's given an event medication before a storm. So those medications absolutely can be used on their own. However, they can also be layered on top of a baseline medication. And it could be that happens just during events. So let's say your dog is on a baseline medication, let's say fluoxetine, for kind of global anxiety, global fears, generalized anxiety disorder. And on top of that, they then get an event medication for specific events, such as departures in the case of separation anxiety. Or they can be used on an everyday basis, maybe sometimes 2 or 3 times a day, depending on how quickly they wear off, layered on top of a baseline medication. And these are usually the patients that have quite severe behavioral presentations, right? These might be dogs that are extremely anxious, or that are extremely impulsive, or have high arousal levels, that are very reactive, in inverted commas. It might be patients that express that through aggressive behaviors. And it might be that the baseline medication alone isn't enough, and we have to layer on top something else on an everyday basis. And that's really where kind of the art of veterinary behavior medicine comes in, is understanding that and knowing how you can use these medications in multiple different ways in order to achieve the best outcome for our patients. Okay, so what are some of these short-acting medications? So gabapentin is one of the ones we use a lot. Trazodone is one of the ones we use a lot. Now, trazodone is a little bit different because it doesn't act on these ionotropic receptors. It also acts on the metabotropic receptors, right? So I said there are a few exceptions here. And again, this is where you need to really know your medications. So gabapentin, trazodone. There are sort of classic short-term medications that are used very frequently, but also medications such as clonidine, or Cilio, which is dexmedetomidine, or a mucosal gel. So they act on metabotropic receptors. There are alpha-2 receptors, but they have quite a fast action. So those are probably your classics. There are a few others, ditomidine, so anything that falls into the category of the alpha-2 agonists, as well as gabapentin. We now also have pregabalin, and there's a great veterinary-specific product that's just recently come out called Boncat, which is available now in Europe and the US. It's been licensed for pre-veterinary visits for cats, so that's a great option. So those, and then of course benzodiazepines, they would be also your short-acting event medications. They act on GABA A receptors, which are those ionotropic chloride channels, which are really fast-acting. So those are all of our medications that fall into that short-acting event medication class, and that can be used in the ways that I've just said, either on their own for specific events, together with baseline or long-acting medications for specific events, or on a daily basis together with your long-actings for perhaps more severe presentations. So I hope that has kind of cleared up maybe the confusion a little bit. To add to the confusion, we also have other medications that kind of fall between the two, right? They're neither long-acting nor are they event medications. So I'm thinking about medications here such as buspirone, which is an azapirone, or maybe Pexion, imepitoin, which is a partial GABA agonist. So there are a couple that kind of fall between those two clear kind of camps, if you like. And again, that's really where sort of veterinary behavior medicine comes into its own. It's understanding those medications. But more importantly, it's understanding the neurobiochemistry. It's understanding the receptor profiles and the neurotransmitter profiles. It's understanding which neurotransmitters they act on, but also what kind of receptors they act on. And it's understanding what that patient needs in that particular moment. And this is one of the areas of veterinary behavior medicine that I love the most. I just find it absolutely fascinating. And it requires a lot of skill. It requires you to understand, hang on a minute, the pet is showing this kind of behavior. So which neurotransmitters do we think are involved in this behavior? And then which medications can I choose that are going to affect those neurotransmitters? They might increase the neurotransmitters, they might decrease the neurotransmitters. So what is it that we're wanting to achieve here? And then it's knowing obviously all about the side effects. It's knowing about what medications are licensed for what presentations in what species of animal. It's about understanding the different types of species and which ones respond in a certain way. So we are now using psychopharmaceutical medication in dogs, in cats, in birds, in rabbits, in horses. Those are certainly the species that we have papers on. We have some case reports on some zoo animals, a snow leopard, some wallabies. So we're starting to use these medications in more and more species. And we've got more and more evidence base and literature on for those medications in different species. We now have a paper that looks at gabapentin in rabbits and has a dose range for that. We have trazodone in rabbits, and we have a dose range for that. We've got lots of papers on medications for dogs and cats. We've got a fluoxetine paper for horses. We've got trazodone papers for horses. So we've got more and more evidence base gathering around these medications. However, that doesn't negate the need to really understand really well in a lot of detail how these medications work in the brain, what neurotransmitters, what receptors they affect, and what that means. And don't get me wrong, we don't know everything about these medications and how they work yet, right? Because if they work on one neurotransmitter, it could be that in turn that they're affecting other neurotransmitters as well. So serotonin is a classic example here. If we have medications that are affecting serotonin, we know for sure that that has a knock-on effect both on dopamine and noradrenaline as well, maybe also GABA. So it's complex. The picture is complex, but that's why we need to at least understand the basics. And we don't just kind of, use the medications willy-nilly and just kind of, give them because we think that that's the right thing. So it's really important to understand that piece. Okay, so the final thing I want to quickly add here is that I have a webinar on psychopharmaceuticals. It's probably about an hour long. The cost to purchase it is only $19, $19. I'm going to drop the link to it in the show notes. So for anybody that has enjoyed last week's episode and today's episode, and that maybe wants a little bit more of a comprehensive overview, go and have a listen to that webinar. But that webinar is going to be disappearing soon. It's going to be being replaced by something else. And this webinar isn't going to be kicking around, certainly not at this price, for very much longer. So now's a great time to get that webinar if that's something that you're interested in. Like I say, it's the price of a cup of coffee-ish, $19. It's a really great price for a lot of information, and it's a really great summary of what I spoke about kind of last week and in today's episode. And like I say, it's going to be being replaced very shortly with something super exciting, which is not going to be at that price point. So if you would like to, please click on the link in the show notes or on social media as this episode comes out, and get yourself that webinar for just $19. Or if you want to wait for the new and exciting thing that's coming out very soon, you can also do that. Obviously, we'll be talking a lot more about psychopharmaceutical medication, and we're going to be diving more into each individual medication and kind of looking at, when would I use fluoxetine over clomipramine, over sertraline, over paroxetine? What are the different reasons? When might I reach for venlafaxine? When would I layer, a short-acting medication on top of that? So all of those things we're going to be diving a little bit more deeply into in upcoming weeks. But like I say, that webinar is great. And it's actually, that webinar is suitable for vets, veterinary nurses, pet care professionals. So if you're a trainer or a non-veterinary behaviorist, but it's also great for caregivers. So I've had lots of clients contact me because they think medication might be an option for their pet. They think, oh, I feel they're anxious, I feel they're highly aroused, I feel they're irritable, and training isn't working. So caregivers actually approach me to ask, might medication be an option here? And so that the webinar is really understandable for everybody. It's I don't make it complicated. It's something that everybody can relate to. So if you're a caregiver and you're maybe wondering, might medication be an option for my pet, then this webinar is also a really great option for you. So check it out, like I say, in the show notes, or find us on social media. We are at Trinity Vet Behavior. We are also on Facebook, so Trinity Veterinary Behavior. We have our Pet Behavior Community, which is a Facebook group that you can join, which will have all the information on how you can get hold of the webinar in there too. So that's how you can find us and find the webinar if you're interested in it. All right, that's it for today. Now, I do want to quickly chat about next week's episode, because next week is episode 52, which means it's our 1-year episode. And it's actually going to be a conversation between myself, Nora, and Ilse. And we're going to be reflecting on our first year of podcasting and what the podcasts have taught us, what we kind of have learned from this whole experience, what the feedback has been, what have been sort of your main takeaways, what people have reached out to us about, what have been the things that I think have been most captivating for listeners. And we're also going to be talking a little bit about the next year and what the next year holds. So if you're interested in that, then tune into next week's episode, which is episode 52, where we're going to be celebrating a year of podcasting. So for now, I hope you found this episode interesting. I think you can probably tell how passionate I am about psychopharmacology and behavior medications. And grab yourself that webinar before it disappears if you would like to. And I look forward to seeing everybody next week. All right, bye for now.